Welcome to Raja Nursing Education. In this video, we are going to discuss about nursing indirect questions for DHA, Prometric and MOH. Which of the following is a known lifestyle related or environmental cause of brain and spinal cord tumor in adults? A. Smoking. B. Exposure to pesticides. C. Radiation exposure. D. All of the above. The answer is D. All of the above. The mechanical ventilation with a rate and volume to maintain a mild hyperventilation is used for a patient with a head injury. To evaluate the effectiveness of the therapy, the nurse should A. Monitor oxygen saturation, B. Check arterial blood gases, C. Monitor intracranial pressure, D. Assess patient breath sounds. The answer is C. Monitor intracranial pressure. A patient has ICP monitoring with an intraventricular catheter. A priority nursing intervention for the patient is A. Constant monitoring of ICP waveforms, B. Removal of CSF to maintain normal ICP, C. Aseptic technique to prevent infection, D. Sampling CSF to determine abnormalities. The answer is C. Aseptic technique to prevent infection. Latest sign of ICP include which of the following? A. Decreased blood pressure, B. Narrowed pulse pressure, C. Increased pulse rate, D. Projectile vomiting. The answer is D. Projectile vomiting. The nurse providing care for a patient at risk for increased ICP after head injury, which of the following is the reason for putting the patient head in a midline neutral position? A. This position provides comfort for the patient. B. This position protects the cervical spine. C. This position facilitates venous drainage from the brain. D. This position promotes the integrity of the skin. The answer is C. This position facilitates venous drainage from the brain. Monitoring the signs of increased ICP is an important nursing measure for patient exposure to head injury. Signs of increasing ICP include A. Bradycardia, B. Increased systolic blood pressure, C. Widening pulse pressure, D. All of the above. The answer is D. All of the above. The nurse performs an assessment for a patient with a brain tumor complaining of dysphagia. Which of the following cranial nerve should be examined in this condition? A. Hypoglossal, B. Vestibulocochlear, C. Vagus, D. Glossopharyngeal, vagus or hypoglossal. The answer is D. Glossopharyngeal, vagus or hypoglossal. Which of the following method is used to assess the cranial nerve level? A. Open a vial of clouds and ask the client to identify the odor. B. Shine a flashlight in the client's eyes and observe the pupils. C. Ask the client to shrug his shoulders. D. Use the Snellen chart and have the client identify letters. The answer is C. Ask the client to shrug his shoulders. Which of the following is determined as a classic symptom that supports the diagnosis of brain tumor? A. Nervousness and seizure. B. Headache, vomiting and papilledema. C. Tachycardia, tachypnea and hypotension. D. Unexpected loss of motor function, diarrhea and changes in taste. The answer is B. Headache, vomiting and papilledema. A female patient with a cerebellar brain tumor is admitted to a neurological ward, the nurse formulates a nursing diagnosis of risk for injury. Which related to phrase should the nurse add to complete the nursing diagnosis statement? A. Related to visual field deficit. B. Related to difficulty swallowing. C. Related to impaired balance. D. Related to psychomotor seizures. The answer is C. Related to impaired balance. A male patient with a suspected brain tumor is scheduled for computed tomography or CT scan. Which of the following should the nurse do when preparing the client for this test? A. Immobilize the neck before the client is moved onto a stretcher. B. Determine whether the client is allergic to contrast dyes. C. Place a cap on the client's head. D. Administer a sedative as ordered. The answer is B. Determine whether the client is allergic to contrast dyes. A 52 years old unconscious patient has a nursing diagnosis of ineffective cerebral tissue perfusion related to cerebral tissue swelling. Which nursing intervention will be included in the plan of care? A. Encourage coughing and deep breathing. B. Position the patient with knees and hip flexed. C. Keep the head of the bed elevated to 30 degrees. D. Cluster nursing intervention to provide rest periods. The answer is C. Keep the head of the bed elevated to 30 degrees. A patient with a head injury has a score of 5 on the Glasgow Coma scale. How should the nurse interpret the score? A. The patient is alert and oriented. The patient is unresponsive and comatose. C. The patient is awake but lethargic and drowsy. D. The patient responds appropriately to commands. The answer is B. The patient is unresponsive and comatose. An acoustic neuroma is a benign, slowly growing tumor of which cranial nerve? A. 8th cranial nerve. B. 5th cranial nerve. C. 7th cranial nerve. D. 9th cranial nerve. The answer is A. 8th cranial nerve, vestibulocochlear nerve. The nurse assesses a patient with an acoustic neuroma who has been recently admitted to neurology unit. What symptoms is the nurse likely to find during the initial assessment? A. Loss of hearing, tinnitus and vertigo. B. Loss of vision, change in mental status and hypothermia. C. Loss of hearing, increased sodium retention and hypertension. D. Loss of vision, headache and tachycardia. The answer is A. Loss of hearing, tinnitus and vertigo. A nurse is caring for a client who is having surgery for the removal of an encapsulated acoustic tumor. Which of the following potential complications should the nurse monitor for postoperatively? A. Ischemic shock. B. Hemorrhagic shock. C. Hypoglycemia. D. Seizures. The answer is D, seizures.